BPDCN is a very rare disease that arises from the plasmacytoid dendritic cells and can affect every organ in the body, but usually affect the skin, the bone marrow, the central nervous system, and lymph nodes around the body. The optimal therapy for BPDCN is really unknown, with ALL-based therapy, AML-based therapy, and tagraciclib as optional therapies. Transplant is the optimal goal if we can get there, if patients are eligible, and to try and achieve long-term remission. And the knowledge about any prognostic factors in BPDCN is really scarce. Thus, we wanted to generate a prognostic model that can help us define risk categories in BPDCN. Using a comprehensive data set of 66 patients with BPDCN with a median age of 68, we utilized a machine learning process called recursive partitioning, and we generated a three-parameter prognostic model that can differentiate the prognosis into three groups. One, which is favorable, was composed of patients aged 50 or less. The intermediate group was composed of patients with either that are over the age of 50 and had either overt bone marrow disease, which is defined more than 5% of BPDCN cells in the marrow, and absence of signaling mutations, or patients with no overt bone marrow disease involvement. And finally, the adverse risk group with a median overall survival of less than 10 months was composed of all patients that did not fit into the favorable or intermediate criteria. Thus, using a machine learning process and a comprehensive data set that included therapeutic, molecular, and clinical characteristics, we were able to generate this prognostic model. Like any prognostic model, it should be verified in a validation cohort, and that's a work that is already in progress.